Vamos. Hello, teacher. We are going to start to doing the OPA. Okay. COVID-19 is the name given to the disease that is transmitted by SARS virus. The first contagious of this virus originated in Wuhan, China. The contagion occurred in the most cases by the respiratory route and by the droplets that the infected person expels when they cough or sneezes. What do you think about the coronavirus so far, Susan?
Yes, also this disease affects in different ways depending on each person. Most people who become infected have mild or moderate symptoms and recover without hospitalization. The most serious symptoms are respiratory problems such as asthma, pneumonia, which require hospitalization and oxygen to stabilize. About the vaccination process, um, the vaccination process in Peru began on February 9, 2021 in the main health center of Lima and Callao. And today, almost 27 million vaccines have been applied.
That's very true. In my country, the vaccines, in our country, the vaccine is free, has been applied to all people over 5 years of age, Peruvians and foreigners that residing in Peru. Currently, most people in the world already have the 3 doses to prevent COVID-19, and this has generated that fewer people have this disease and therefore fewer infections. It is recommended to increase the consumption of fruits and vegetables that contains a lot of vitamin A and C, as well as antioxidants, which helps you fight the infection. No? Many people during the pandemic began to use alternative medicines such as natural products and home medicines. On the other hand, it is very important to have a daily routine of physically training home in home in order to stay active and increase immune defenses. No? What do you think about
That's
that,
right.
Susan?
That's right. People have been more aware of their health care since this disease had affected more people with obesity. So they have changed their bad habits and have adopted a healthier lifestyles, having a more balanced diet and incorporating exercise and an exercise routine. One way to slow the spread of the disease is to comply with biosecurity protocols and keep your distance. Also, go to the doctor immediately if you have symptoms.
Okay. The first measure applied by the government was to establish a quarantine for a long time. Then the borders were closed with the different countries. The government forced it to use of mask in all the public places and area. Ordered the hospitals to give priority to the patients who have COVID-19. No? We know that the vaccines against COVID do not cure you 100%. Only the only thing that helps you is to prevent the virus, and in case you get infected, avoid the death. No, but at the present, scientists are looking to create a pill that when you take it, it can cure you 100% of this virus. No, the pill will behave in the same way as if it were a pill from the flu. No.
It's true. We know that there is not a 100% effective cure. However, the established treatments for this disease and vaccine have been able to considerably mitigate the spread of COVID. The challenge we have faced throughout the pandemic are social immunization and adopted it as a new normal. For many people, it was not easy. Likewise, It was also a challenge for the state, since it was not prepared to face a global pandemic.
Yes, we must find a solution to this economy recession and health crisis that this pandemic has left us. The main challenge have to do with the unpredictable of this disease, since many of us were caught by surprise, and we didn't know how to react to this virus. For the next one, we have to be more alert and have more effective sanitary measures. Thank you.